Hello everyone, now let us discuss about 2023 CPT coding guidelines for photodynamic therapy. This comes under the medicine chapter of CPT. Coming to the codes of photodynamic therapy, the codes 96573 and 96574 should be used to report non-surgical treatment of cutaneous lesions using photodynamic therapy by external application of light to destroy pre-malignant lesions of skin and adjacent mucosa, for example on face and scalp, by activation of photosensitizing drugs. A treatment session is defined as the application of photosensitizer to all the lesions within an anatomical area, that is either face or scalp, with or without debridement of all pre-malignant hyperkeratolytic lesions in that area, followed by the illumination or activation with an appropriate light source to the same area. That is defined as a treatment session of photodynamic therapy. And do not report the codes for debridement, that are 11000, 11001, 11004 and 11005, or lesion saving CPTs, or biopsy or lesion excision within the treatment area on the same day as photodynamic therapy. Whenever photodynamic therapy is performed on a specific treatment area, you should not report either the debridement or lesion saving or biopsy or lesion excision codes within the treatment area on the same day as the photodynamic therapy. Coming to the CPTs. The first CPT is 96567. Photodynamic therapy by external application of light to destroy pre-malignant lesions of skin and adjacent mucosa with application and illumination or activation of photosensitive drug per day. The next CPT is an add-on code plus 96570 plus 96570. Photodynamic therapy by endoscopic application of light to ablate abnormal tissue via activation of photosensitive drug first 30 minutes, followed by, this is also an add-on code, plus 96571, each additional 15 minutes. They must be coded along with the bronchoscopy. We will see an example for this. The next CPT is 96574. Photodynamic therapy by external application of light to destroy pre-malignant lesions of skin and adjacent mucosa with application and illumination or activation of photosensitive drug provided by the physician or other qualified healthcare professional per day. The next is 96574. This is debridement of pre-malignant hyperkeratotic lesions, that is by targeted curettage or abrasion, followed by photodynamic therapy by external application of light to destroy the pre-malignant lesion of skin and adjacent mucosa with application and illumination or activation of photosensitive drug provided by physician or other qualified healthcare professional per day. Now here we'll see an example. A patient had a bronchoscopy with destruction for relief of stenosis by laser therapy. During this procedure, photodynamic therapy by endoscopic application of light was used to ablate abnormal tissue via activation of photosensitive drugs. And the photodynamic therapy lasted for 45 minutes. And how would you report this procedure? First, patient had bronchoscopy with destruction for relief of stenosis by laser therapy. And during this therapy, that is during the bronchotherapy or bronchoscopy, photodynamic therapy is employed. So here first you need to report 31641. Bronchoscopy right or flexible, including fluoroscopic guidance, when performed with the destruction of tumor or relief of stenosis. Here it is performed for relief of stenosis by any method other than excision. Example, laser therapy and cryotherapy. Here it is done for the relief of stenosis by laser therapy. And during this procedure, photodynamic therapy by endoscopic application of light was used. So if you see this particular CPT in the book, you will find a note under 31641. For bronchoscopic photodynamic therapy, report 31461 in addition to 31641 in addition to 96570 and 96571 as appropriate. So in addition to 31641, you need to report 96570. Here the photodynamic therapy lasted for 45 minutes. So first CPT is given for first 30 minutes, 96570. That is nothing but photodynamic therapy by endoscopic application of light to ablate abnormal tissue via activation of photosensitive drug. First 30 minutes. Additionally, 15 minutes are more. So because the photodynamic therapy lasted for 45 minutes, 30 plus 15. So for additional 15 minutes, you report 1 unit of 96571. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.